Hi, welcome to my YouTube channel. If you're new to this channel, please subscribe and turn on your notification bell. And to my returning subscribers, you guys are wonderful. Today I'll be discussing with you guys the phases of menstrual cycle. In my previous video, I explained briefly about them, but today I'm going to give you a full detail. Make sure you watch to the end of this video. I'll be right back. The menstrual cycle is a term used to describe the series of events that occur within a woman's body as it prepares for the possibility of pregnancy each month. A menstrual cycle is considered to begin on the first day of a period. The average cycle is 28 days long, but it can range in length from 21 days to about 35 days. The phases in the menstrual cycle are triggered by the rise and fall of chemicals in the body called hormone. The four main hormones are follicle stimulating hormone, abbreviated as FSH, luteinizing hormone, LH, estrogen and progesterone. We have four phases of menstrual cycle, but some school of thought said it's two, but for exam's sake it's four phases, which are the menstrual phase, the follicular phase, the ovulation phase or ovulation, and the luteal phase. The hypothalamus releases gonadotropin releasing hormone, anterior pituitary gland release follicle stimulating hormone and luteinizing hormone, follicles in ovaries releases estrogen, corpus luteum releases progesterone and estrogen, while embryo, in case if pregnancy occur, now releases human chorionic gonadotropin hormone. The hypothalamus is located in the brain. You can see it's being brought out here. And the pituitary gland, which is the master gland, is divided into two, the anterior and the posterior parts. But the anterior part regulates most of the hormones in the body. We also have the pelvic organs, which is also known as the reproductive organ. We have the ovary, where the egg are being produced, mature, and travel down the uterine tube, fertilizing the ampulla, and goes to the uterus for embedment and implantation. But when fertilization does not occur, the lining of the endometrium are being shed out through the vagina as blood. The hypothalamus releases gonadotropin releasing hormone, which will now stimulate the anterior pituitary gland. The anterior pituitary gland will now stimulate the ovary to release follicle stimulating hormone and luteinizing hormone. This follicle stimulating hormone stimulates further development of the egg in the follicle into a mature egg called ovum, while the luteinizing hormone causes ovulation. Each ovary contains immature egg called primordial follicle, and it's about 200,000 each ovary. They are there from birth until the month they are being activated. So once a month, the follicle stimulating hormone stimulates about 15 to 20 of the follicle for further development into maturity, that is ovum. As they start to grow, the cell within the follicle called granulosa cell secretes increased amounts of estrogen. Estrogen is a steroid sex hormone that acts on tissue with estrogen receptor to promote female secondary sexual characteristics. It stimulates the development of breast tissue and other female sex organs such as the vulva, vagina, uterus. It stimulates the blood vessel in the uterus and the development of the endometrium. It also causes the mucus in the cervix to become thinner so that the sperm are able to penetrate around the time of ovulation so that they can get into the uterus and get into the fallopian to get the egg fertilized. It also causes a negative feedback mechanism on the anterior pituitary gland and hypothalamus. As the level of the estrogen rises, it suppresses the release of the follicle stimulating hormone and luteinizing hormone. The follicular phase starts on the 6th day to 14th day in a 28 days menstrual cycle, but the mature egg is fully formed during the 10 to 14 day. That is why it's being advised not to have sex 3 days before the ovulation and 3 days after, because they are favorable period for conception. If you have sex on this day, there are possibility of getting pregnant. Just before ovulation, there is a bit drop in estrogen as the follicle gets ready to release the egg. The luteinizing hormone are now activated and it causes one of the follicle to reach the surface of the ovary and release the ovum, which is the matured and unfertilized egg. Ovulation happens on the day 14 of 28 days menstrual cycle. The luteal phase lasts for 14 days, which starts on the 15th day to 28th day in a 28 days menstrual cycle. So the follicle that releases the egg collapses and it becomes the corpus luteum. The corpus luteum secretes high level of progesterone. So this progesterone now is a steroid sex hormone which is produced by the corpus luteum after ovulation, and if pregnancy occurs, the placenta will take over the production of progesterone from around 5 to 10 weeks of pregnancy. The progesterone acts on the tissue that have been previously being stimulated by estrogen. Example, it causes the thickening and maintaining of the endometrial lining. It thickens the cervical mucus to prevent things going through in and out of the uterus and causes slight rise in body temperature. The corpus luteum also secretes some estrogen. If the egg is fertilized, it secretes human chorionic gonadotrophin (HCG), and that keeps the corpus luteum alive. It is the hormone pregnancy text dictates. But if the egg is not fertilized, no HCG is produced, the corpus luteum will degenerate and it stop producing progesterone and estrogen. And this drop in progesterone and estrogen removes the negative feedback mechanism to the hypothalamus, and the level of the follicle stimulating hormone begins to rise again. The drop in progesterone and estrogen also causes the endometrium to break down, and at this juncture, menstruation occurs. Menstruation starts from day 1 of the cycle. Here, the superficial and middle layer of the endometrium separate from the basal layer, and this tissue is broken down and is released through the cervix and vagina as blood, and it's called period, and it lasts for about 1 to 7 days, but 8 in some people. Let's talk about the level of the hormone. The follicle stimulating hormone activates and drop slightly before ovulation. The follicle of the egg produces estrogen, so estrogen rises and fall also before the follicle is released, as in that is during or before ovulation. The luteinizing hormone rises. It doesn't do anything, so it's kind of flat. But when ovulation, before ovulation, it rises because it's the luteinizing hormone that takes place during ovulation. So progesterone is low in follicular phase because it have no role to play. But this progesterone and estrogen are increased because they are produced by corpus luteum, which is in charge of the luteal phase. So because this progesterone and estrogen help thicken the endometrium. If pregnancy does not occur, the level of this estrogen and progesterone now falls, it drops, and menstruation occurs, and a negative feedback mechanism takes place.